It's Dr. Jason West with the Hellness to Wellness podcast. This is episode 2 about arthritis. And not only am I excited to share with you what you can do for arthritis, the success stories, but we're actually bringing in real life examples, a couple of them, one on traumatic arthritis, another one on chronic low back pain, and then rheumatoid arthritis. It's just a really neat episode that we have planned for you. And remember, if you want more information about the office, about the books, about the podcast, the live cast, the live events, what we're doing on the media, you can go to drjasonwest.com. And if you'll sign up and get registered, which is totally free, we're going to send you our blood sugar report, how to beat blood sugar without feeling deprived. And one of the reasons we're doing this is, the main reason we're doing this is because it's just tragic when you hear people that are having unnecessary surgeries. They're taking over-the-counter medicines like they're going out of style. It's hammering their stomach. They're not feeling very well. They're accidentally hardening their kidneys, and they say, Dr. West, I wish I would have found you sooner, or I wish I would have found clinics like yours sooner. And so we wanted to have a platform to help people understand their clinical options. So www.drjasonwest.com, free sugar report. And then it's just amazing. All the information we put together on 100 types of arthritis: rheumatoid arthritis, osteoarthritis, skin arthritis, autoimmune arthritis, muscle arthritis. There's 100 different types of diagnoses, includes gout, crystal deposition disease, mixed connective tissue disease, fibromyalgia, the whole gamut. We put together this program at the end of 2019, and if you want more information, again, go to our website, drjasonwest.com. The free ebook that we talk about, we're going to reference into it, is called The Arthritis Cure, and what some neat things we're excited to share with you. Now, everybody wants to know, hey, does it work for me? And what I'm going to tell you is, well, if you have irritation in the joint, doesn't matter where that it comes from, you're going to get the diagnosis of arthritis. Arth means joint, itis means inflammation. And one of my favorite cases is going all the way back to 2006. One of my dear friends, Jerry and Kitty Ryan, they came to the office, and here's Jerry's story. Check this out. Here you go.
Well, in 1988, I had my ankle crushed in an industrial accident, and it just kept getting worse and worse and worse. I had many steroid injections, epidurals, and whatever. Pretty quick, I couldn't stand it anymore, and they were going to amputate my leg on the 3rd of December. About, I think that was 5 years ago. We had a man digging a trench into our barn to put water in there, and he told me that he had his knees worked on. He'd been unable to get in and out of his pickup or up on his backhoe, and there was a doctor in Pocatello, Idaho that worked on his knees. And he says, you should call him up. And I thought, yeah, everybody has told me about their miracle doctor, and I did nothing about it. And he come in to get paid. And he said, you didn't call him, did you? I said, no. He says, let's call him right now. So he called Dr. Jason West, and this was on a Thursday, the 22nd of November. 3rd of December, we had decided to have it amputated. But he called Jason up, and they said, yeah, I'll see him on Friday. That was the next day. And I came down here, and they took 6-7 x-rays. Said, you have an awful bad ankle, and we don't know if we can help you or not, but it's worth a try. So he took me in the room and injected my ankle, and he says, okay, get off the table and walk. Well, I left my walker there, and I walked out, and I've been walking ever since. I've had 5 or 6 injections. They last longer every time. First one lasted about 5 or 6 months. Second one a little longer. I haven't had one now for a little over a year. My leg is still not bothering me.
So you guys, it is hard not to get emotional on that story. It's over 10 years ago. I haven't seen Jerry for a little bit, and everybody wants to know, What did you put into a system? And the answer is an all-natural solution. It's a regenerative injection therapy where you take a vitamin B12, you take a glycolized ester of para-aminobenzoic acid, which is a huge mouthful, but a glycolized or sugarified B vitamin, which nourishes the nerves, a little bit of vitamin C, a little bit of magnesium, and some oxidative medicine. It's what we call RIT therapy, regenerative injection therapy. And it's not a steroid, it's not a painkiller, it's not something that you have to do for the rest of your life. You can actually get joints to heal, and that's exactly what we did for Jerry. Now, Jerry had traumatic arthritis. There's a whole bunch of different types of arthritis. We're going to show you examples of back pain arthritis. We're going to show examples of autoimmune arthritis. But here's some arthritis basics that I'm so excited to share with people because they just make sense. The first thing is to make sure you get enough water. A shout out to Dr. Batmanjiti, who wrote a book about your body's many cries for water. And he said arthritis is literally a dehydration symptom. So get enough water in the system, and it's water. It's not liquid intake. I was listening to a doctor talk radio show and I almost wrecked the car. And here's why. I'm driving down the road and they say, doctor, I'm not going to use the doctor's name, but the caller called in and said, Doctor, I love drinking soda pop. I don't like to drink water. And the doctor said, oh, that's okay. You're getting enough water and soda pop. I almost crashed the car because it's one of the worst things that you can do for arthritis. One of my favorite stories is a gentleman that came in and he literally had his arm like this. He couldn't move his arm like that. He had massive gout in his shoulder, and they were going to do a shoulder surgery. And he came in and he said, is there anything that you can do for me? And I said, well, what are you drinking? He says, I drink two things. I drink Coca-Cola and I drink orange juice. And I said, well, both of those are really acidic. Would it be worth it to you to not have the surgery if you'll give Coca-Cola and orange juice a break? And sure enough, he decided that it was worth it to him. He went on that program. He got rid of the carbonic acid in soda. He got rid of the excessive citric acid that he was getting from orange juice. And literally about 6 weeks later, he came full range of motion of his shoulder. You are what you eat. You are what you absorb. And so one of the biggest things, let's just get some more water intake. And then we want to reduce your sugar intake. Now again, we've made this offer multiple times, drjasonwest.com. If you'll go there, you can get our blood sugar report, how to get rid of sugar cravings without feeling deprived, because sugar is so inflammatory and it hampers your immune system. So many times people will say, well, Dr. West, why would I worry about immune system? I've got arthritis. And the answer to that is that arthritis is inflammation. Sugar causes inflammation. If you decrease your sugar intake, it decreases the inflammation, and then you have less of a need for prescriptive anti-inflammatory therapy or some of the unwanted side effects of over-the-counter medicines. Now, my concerns with over-the-counter medicines is they're not benign. You can't just pop a bunch of Tylenol, acetaminophen, ibuprofen, Aleve, or aspirin and not have it have a unwanted side effect inside your system. It's really important to recognize that all of those over-the-counter medicines have effects. So when we start talking about the treatments for arthritis, there's a lifestyle therapy, which means getting more sleep, getting enough water, get your body on a schedule, eat healthy and alive foods. That's the first step, and it helps so many different conditions. Then we have advanced nutritional therapy, which we're going to talk about. One of the most important things is getting calcium into the right spot. Now, calcium is the most abundant mineral in the body. It's so important for making sure that you have healthy bones. It helps your immune system. It's a physiologic relaxer. It helps with muscle cramps. It helps with stamina. And one of the problems that we have is too many times people are saying, just take calcium for arthritis. And it's not balanced with other minerals, and it's not balanced with other cofactors. So let's talk about calcium metabolism for just a minute. So many times you get calcium in the wrong place, inside the joint, which we call osteoarthritis, or you can get an unwanted bone spur, plantar fasciitis, bursitis, and irritations inside of the joint because there's too much calcium in the bloodstream. So when you take calcium, you need to have an acidic stomach. The calcium needs to go down into your stomach. It has to be broken down. And then vitamin D3, also known as cholecalciferol, takes calcium out of the stomach and puts it into the bloodstream. Now, most people have heard about vitamin D3. It's fantastic. It probably would be easier to write a book about what vitamin D doesn't do than what vitamin D does do. But one of the most important things that it does, takes calcium out of the stomach, puts it in the bloodstream, and then vitamin F. Vitamin F takes it out of the bloodstream and puts it into the tissues. Now, so many times people are saying, what the heck is vitamin F? Vitamin F is basically unsaturated fatty acids. If you don't have enough vitamin F, what happens is the calcium precipitates out of the bloodstream and it literally clogs up the joints. So when we talk about osteoarthritis, if you get too much mineral condensation in the joints, you hurt and you can't go up and down stairs. Your hips don't work right. Your shoulder doesn't move. You have decreased range of motion. And then the last part is vitamin K2 activates it into the tissues. So the right kind of calcium, we're going to talk more about that in just a second. Vitamin D3, vitamin F or unsaturated fatty acids, and vitamin K2. If you have all those building blocks, calcium goes to the right space, and what happens is you get healthy bones, you get healthy muscles, and you have decreased joint stiffness. Now, the other thing that's really neat about getting rid of stiff joints associated with arthritis is a sugarcane extract called Wilson factor. Now, we take sugarcane, we take the poison out, and we give it to people, and then what happens is we throw away all the good stuff. Wilson factor was named after a doctor in Oregon, Dr. Wilson, who found that guanidine is really alkaline substance. It actually pulls calcium into the joints, and the sugarcane extract, what it does, it helps to detoxify guanidine. It pulls calcium out of the inappropriate places. So bone spurs, plantar fasciitis, shoulder tendonitis, and things like that can be aggravated by too much calcium, which incidentally, even though this isn't associated with arthritis, did you know that cataracts are associated with improper calcium metabolism? And vitamin F, unsaturated fatty acids, helps to clean up eye conditions. Now, it takes a long time for the cataracts to get there. It can take a long time to go away, but that's just as a little side note of the benefits of unsaturated fatty acids, and also known as vitamin F. What's really interesting too is if people have thick skin and rosacea and other things, they have too much vitamin D and not enough vitamin F. It's such an important part of osteoarthritis. So when we start talking about nutrition, you have the Wilson factor, you have glucosamine chondroitin, you have curcumin, you have ginger, you have all these amazing things that are healthy, things that reduce your blood sugar. And if you want to know where you get it, you can get it on personalized OTC. Now, we put that program together because there's so many important things that you need to get inside of your diet, and most of the stuff is junk. And what do we mean by that? Is people are taking the wrong kind of calcium, they're not getting enough vitamin F, and we put together a program. You can go right here to the website, Personalized OTC, and you can get Joint Revive and Joint Renew. It has everything that we have inside of that, Joint Revive and Joint Renew. It has the Wilson factor in it. Now, some other advanced therapies that we wanted to talk about is we have regenerative injection therapy, which are things like prolotherapy, prolozone therapy, peripheral neural injection therapy, neural prolotherapy, and neural therapy. Now, those are a whole bunch of different big words, but let me tell you what those really help you to do. It helps to stimulate the body to heal. Now, what I'm really excited to share with you is a patient. He came from Ohio to the office. His name is Russell Webb. Now, Russell's story is he was broken down, back hurt, knees hurt, shoulders hurt, trying to figure out what to do. The surgeon's saying, hey, we want to delay your surgery as much as possible. And I'm so excited to share with you Russell's story. Here it is. Check this out.
About 14 years ago, I injured my back really badly. Went to multiple chiropractors and doctors, never was able to get relief from the pain. As a youth, I've had problems with my knees ever since high school, and all of these problems continuing to get worse. A relative of mine had come to see Dr. J and suggested that I might come up here and get relief from some of the pain I had. And so I was willing to, at that point, because the pain was so bad I couldn't sleep at night. My back hurt so bad I would have to prop pillows up under my legs and my back to kind of position my body into a V to take the pressure off. When I could do that, I could sleep probably 3 or 4 hours, but that was it. I came here to the clinic and explained what was wrong, and they gave me some treatments that definitely helped. When I was much younger, I had a condition called Osgood-Schlatters disease, which is, as I understand it, and I'm probably getting this wrong, your bone actually grows faster than the muscle, and it causes a pulling of the muscle against the bone and where the muscle's attached to the bone. The muscle tore free from my leg in my knee joint and ripped a chunk of bone loose. They reattached that and then casted me for 6 months, which caused huge problems with muscle atrophy and other things. The pain never completely went away. I continued to play high school sports and other things that probably weren't good for it. And I've just lived with that my entire life. That was one of the major problems I was having when an uncle of mine suggested I try this. And after I came to see Dr. J and had the prolozone injections, I was completely pain-free within hours of the treatment. That was about 18 months ago. The pain started coming back. So I came back for another treatment, and it's solved the problem again.
You've had to run into a lot of skepticism.
A
Tell me
lot.
about that.
I've sent a lot of patients up here to see Dr. J in his clinic. Every time I tell someone about my story and tell them, they get that look like, really? And all I can tell them is, it works. I'm proof. That's it. Every person I've sent here has had the same positive results. My parents, many other family members, friends. I think the number's totaling close to 30 now. Every single one of them has had positive results. Would recommend this just like I would. I don't know the science behind what the treatment is. I know the names of the things that he injects into me, but it works. That's the only thing I can say about it.
So you guys, that's Russell's story. Now on the video, it talks about being from, Cave Creek, Arizona. Then he went out to Ohio, and Russell's really special to me. And it's not just him that has that outcomes. You've heard he's had over 30 referrals to the office. They've all had the same experience. And the reason why we get such good outcomes is because we give the body what it needs. Now, what it needs is some lifestyle changes. You want to get water into the system. You want to eat healthy and alive foods. And then you want to make sure that you get the nutrients that you need. Now, nutrients that you need include the unsaturated fatty acids, also known as vitamin F. You want vitamin K2 inside your system. There's so many things that help with inflammation besides Tylenol and aspirin. And then the other thing that I'm excited to tell people about is the regenerative injection therapy that we do is literally like putting plywood and 2x4s and sheetrock into the area so that you can remodel the joint. And it's just fantastic for chronic back problems, hip problems, knee arthritis, ankle arthritis, shoulders, elbows. You get the tennis elbow, you get carpal tunnel syndrome. This works so well with that. You combine it with the other types of nerve therapy, which we're going to talk about right now. It's called neural therapy, and you can get nerves to rewire. Now, how do you do that? There's so many healthcare conditions that are related to nerve memory. And what is nerve memory? That's what happens when your nervous system thinks that being in pain, having arthritis, having autoimmune disorder, having a different organ dysfunction is normal. So an example of that, I have a lot of rodeo and rancher guys come into the office. And every once in a while, one will come in and they'll be out roping, and they'll get rope caught around their finger, and the cow takes off and it pulls their finger off, and they'll come into the office and they'll say afterwards, "Oh my gosh, Dr. West, my finger is killing me. It's not even there anymore." We call that phantom limb syndrome. That's because the nerve's been injured and it's telling the brain, I hurt, I hurt, I hurt. And now if your body was a computer and you called up tech support would say, turn everything off and turn it back on, reboot the system. Well, there is a German treatment called neural therapy. It was discovered by Dr. Huneke about 100 years ago. One of his proteges, Dr. Dosch, and Dr. Dosch's son wrote a book about it called Neural Therapy. It's absolutely changed my life. It's changed the life of thousands of patients, because what you do is you can take a special type of B vitamin. It's totally natural, and you can go basically to superficial areas of the body, just into the skin, and you can inject it with this B vitamin, and what happens is it makes the nerves open and close and reset. It literally reboots the system. So you can put the nutrients inside the area that's damaged to help remodel the system, and then you can rewire the nerves. And then what you do is you get out of the way and you let the body heal. So as a quick recap, so far we've been talking about osteoarthritis. We have a whole program called the Arthritis Cure. It's arthritiscure.com. And I wrote it as a tribute to one of my friends, Dr. Levy, who wrote the book, The Vitamin C Miracle, called Curing the Incurable. And I wanted to pattern and follow that, because one of the things that you can really do to help people to get nutrients inside their system is to do some vitamin infusion therapy. And I'm going to show you an example of that in just a minute, of a lady named Patty, and how Patty was able to beat her arthritis using something a little bit differently, but lifestyle, water, the right types of supplements, the right types of building blocks, decreasing inflammation. And where you can get it is on our website, Personalized OTC. That's one option. And I don't even care where you get it. I just want to make sure that you have a good source that's a good quality supplement, because when you get the body nutrients that it needs, you get amazing clinical outcomes. So Dr. Levy wrote this book called Curing the Incurable. It's about vitamin C infusions. You skip the stomach, you put vitamin C into the vein, and what happens is it donates electrons to the body. Now, why this is so important? Because so many healthcare conditions are associated with the decrease of energy. You give people's energy back, and guess what? Fibromyalgia starts to go away, chronic fatigue goes away, arthritis goes away, rheumatoid arthritis goes away, Hashimoto's goes away, hormone imbalances dramatically decrease, stomach problems get better. It's so important to have energy, and vitamin C is like putting your old tired body inside of a battery charger and charging it up. So I'm going to share with you Patty's story, and then I'm going to tell you exactly what we did for her, and then we're going to tell you how you can get some help distance, how you can get stuff inside of the office, and how you can get your life back. So here's Patty's story. Check this out.
I was basically hooked to my chair, and I could hardly move at all. I could hardly even function. Just to breathe in some days was painful. It was truly horrible. I remember sometimes I'd wake up in the mornings and just open my eyes, and the tears would just come. The tears would just come because the pain was still there. It just never, ever went away. And, they talk about hope here. And I can't even tell you how true that is, that they actually give you hope. I never dreamed I'd ever be able to feel like this again. I just never dreamed I'd ever be able to feel like this again. To be able to just get up and to move around and to do things with my grandkids and my kids and my husband. It has truly just been a miracle. It really has for me. I had a little grandson that's 4 years old, and he loves to get down and play cars. And I remember him saying the one time, "Grandma, will you come down and play with me?" And I'm like, "Yeah, I think I can." And to be able to get down on that floor by myself and to push the cars around and to play with him for probably about an hour, and then to be able to get up by myself. It wasn't pretty, but I was able to get up by myself. It was truly amazing.
And so, Patty, everybody's going to know, okay, what was the secret sauce? What do we do? And so the treatments that we did, We did, you changed some lifestyle things, which are huge. We put you on a supplement program based upon the findings that we found on your blood tests. But what do we do in the office?
Well, they gave you the IVs.
So we did some vitamin infusions.
Yeah, the
and then we did some injection therapy.
Yes, and the injections. And at first, those injections were painful. That was not fun.
Okay, we'll edit that out. They do hurt.
Yes, yeah, but they get better. The first one was really hard, and stuff, but they get better, and you almost are looking forward. Truly, you're looking forward to getting those shots because of how much they help. They really do make a big difference.
I always want to make it that people don't need the office. So we did a reevaluation today, and Patty, what did we see?
Oh, my blood looks great. I'm a cancer survivor, and we didn't see any signs of cancer in my blood, and everything looks pretty good.
So really, from here, it's just tweaking. We want to help her clean up a little bit of residual stuff, but we don't need to do a big overhaul. It's just, hey, you're doing really well. And when we saw her come in, she just beamed. Before, it was kind of like, hey, there was a battery that didn't have a charge. Yeah. And that's why people get sick, is they run out of energy. And then for Patty to say, I was able to play cars with my grandson, it was just awesome.
Yeah.
And I went home, and my wife's like, how would it go today? I'm like, you don't believe it. I helped someone play cars. And she kind of chuckled, and I'm like, but you don't understand the backstory. So Patty's okay if I put this up for people to get some hope?
You bet.
So this is Dr. West and Patty signing out, Daily Dose Vitamin H at the West Clinic. She's one of my heroes. She had a sickness. We're winning. It's really fun to be a part of. We'll see you guys on the next video.
Thank you.
So Patty talks about being a cancer survivor, but one of the things that she wanted to do is, I just want to have a life. And it was a inflammatory arthritis diagnosis, and we did just exactly what I told you. We put her on a lifestyle program to help get more water into her system, healthy and alive foods, decreasing inflammatory foods. You are what you eat, and you are what you absorb. And by the way, this isn't a one-off story. This isn't a medical miracle. This is what happens when you give the body the things that you need to improve. And this was the micronutrient therapy, where we skip the stomach, we go right into the veins, and what it does is it helps people to heal from the inside out. Then we added the micronutrient infusion therapy and what they call ultraviolet blood irradiation therapy, UVBI therapy. Now this is a therapy that started in Germany in the 1940s. There's a fantastic paper that's in our arthritis program. And if you need more information, go to drjasonwest.com. It's a free sign up. You'll get a blood sugar report, but you're also going to get tons of free information that empowers you to beat your diagnosis. And the reason why we keep saying that is you're not your diagnosis. There's a person in there. You just don't get slapped with a disease or a condition where you name it, blame it, and contain it. That's not how we do things inside the West Clinic system. And by the way, there's doctors out there that are doing exactly what I'm doing, which is to help people to improve, to achieve, and maintain optimal health. Ultraviolet blood irradiation therapy is an IV treatment where we take out some blood, we put it into a bag with a little bit of saline, we put some ozone in there, oxygen, the blood will go from purple to bright red, and then what it does is you run it past an ultraviolet chamber back into the body, you attach a photon of energy to each red blood cell, and it's like putting sunshine in the system. It decreases overall inflammation. The original cause or reason for doing this was infection. And they saw a significant improvement in people that were terminally ill. And then there was a massive response for chronic infections like Epstein-Barr, staph infections, MRSA infections, mycoplasma infections. It's one of the things that we always do for Lyme disease, but it has such an amazing anti-inflammatory component. It reduces inflammation everywhere. That's what we did for Patty. We also did some injection therapy, the neural therapy that she said, well, it hurts. And we said, we better edit that out. And then I thought, you know what, I'm gonna leave it in there because I want people to understand that a little bit of pain is worth it to get those nerves to reset, give the body the nutrients that it needs, and these are the outcomes that you get. Now, it's just not Russell and Jerry and Patty. I have hundreds of video testimonials on our blog. It's Daily Dose Vitamin H. And what happens is we've just put up patient success stories. We've been talking about arthritis. We're gonna cover autoimmune. We're gonna cover Lyme disease. But arthritis, there's so many treatments that are just fantastic for it. you've got neural therapy, you've got prolozone therapy, you've got UVI therapy, and people all of a sudden are getting their lives back. They're able to play cars, they're able to go fishing, they can throw a football, they can do so many amazing things. This is Dr. Jason West on the Wellness to Wellness podcast. We'll see you guys in the next episode. We're going to talk about Lyme disease. We'll see you guys later.